Hey, I'm Alan Acton, one of the dentists here at Cary Family Dental, and I'm excited to be talking to you today from our office at 915 Kildare. It's one of our second offices. You can see our big sign that we've got here on the wall. And you'll notice that Dr. Madden and I are 6 feet apart because we're smack in the middle of coronavirus time, and so we're taking the requisite precautions. And one of the reasons that I'm here today is I wanted to introduce you, our patients, to Dr. Kristin Madden. Now, many of you may not have had a chance to meet her, but Kristin and I have been working together for going on 3 years now. And she has been, for those of you who have met her, you may have met her on a Saturday, because as you know, we're open 6 days a week, or 5 days a week right now. But Dr. Madden has been working many of our Saturdays together, or with us. But those of you who haven't met her, I thought this would be a good time for us to kind of talk and for you to get a chance to meet some of our patients. So let's start a little bit. One of the things I find most interesting about you is that for a number of years, you worked with your parents who are also dentists. Is that right?
Yes, that's right. Both my mom and my dad are dentists, so I guess you could say it was in my blood. Although as a stubborn teenager, I used to swear I was never going to be a dentist like my parents. But of course, as I got older, I realized that dentistry really did incorporate a lot of my interests and values, and it really was an amalgam of my very many things that I enjoyed doing, such I like working with my hands, I like art, I like working with people, I like using Spanish, I like education, and I do find that dentistry has all of those things and more.
Yeah. So what was that like working with your dad? Was that your mom too? Both your parents are dentists. So did you enjoy having the family all together?
I did. I guess when I started out when I was 14, I suctioned and cleaned rooms and turned rooms over. As I got older and joined them as an associate once I finished dental school, it was interesting to go from one side of the chair to the other, but I enjoyed that transition as well. My parents were both wonderful practitioners, and they both had different strengths that they pulled from one another. I know for me, I worked the last several years as a contract dentist. I'm kind of looking for the right fit. I've been so fortunate to work with my family for so long that I really was looking for that in another practice, and I feel like I've been fortunate to find it here.
Yeah, that's great. I mean, we've really felt like, as long as I've been working with you, one of the things that you've really been great about is becoming part of the team almost instantly. The team members really enjoy working with you, and the patients really enjoy working with you. And I've really found you to be an excellent dentist.
Well, thank you.
Yes. And I'd like to talk about that a little bit. Within dentistry, there's so many different things that you can do, and that's one of the things I like about being a general dentist is that I can try many different aspects of dentistry and really experience all that and be able to help our patients out in many ways. And I found that to be the case with you. You seem to enjoy that aspect. And so there was a time where you were thinking about going on and advancing your education further in dentistry and decided to stay as a general dentist. Is that right?
Yes, that's correct. Yeah.
And so what had you thought about doing?
I was interested in orthodontics. I did apply and get into ortho school. I guess, however, after working and kind of finding my nice family, and I enjoy North Carolina too much, I've decided just to stay as a general dentist because, as Dr. Acton said, I really enjoy the variety it has to offer. And even as a general dentist, we do a lot of Invisalign at our office, and so I enjoy working with Invisalign patients and children and people of all ages.
Oh, that's great. Yeah. So outside of dentistry, there's probably a number of things that you like to do as well. And I think I remember you saying that right before that coronavirus hit, you were going to travel to Italy. Is that right?
That's right. Yeah. I was supposed to be going on a trip to Venice. We were going to fly in and out. My boyfriend owns a wine bar and is a sommelier, so he definitely has a very different level of expertise on things than I do. But we were going to fly into Venice and make our way around to Slovenia, where there was going to be an orange wine festival. Even the orange wine festival was postponed this year due to the coronavirus, so that's still going to be on our bucket list to do another year.
Oh, that's great.
Yeah.
And what else other than travel? Do you have any other interests or hobbies or anything that you like to do?
Yeah, and just enjoy gardening, working around that, which I guess nowadays is a great time to do that since you can't go a lot of places. I like reading a lot. I also enjoy bird watching. I have a lot of bird feeders and bird houses in my yard. Luckily, some of my family shares those similar interests with me as well. I'm hoping to get back to traveling once everything's a little bit friendlier and we don't have to wear masks all of the time.
Yeah. Oh, that's great. Well, it's been really great working with you. And is there anything that you think that our patients should know about you, or what the experience is going to be like when they come into our office, or maybe like how you view your role as a dentist in affecting other people's lives?
I think I was fortunate enough to have my mom and dad as my dentist, so I find whenever I have a new patient or meet somebody new, I want them to have that same experience I had. I don't want to hear stories of people having bad experiences, and I don't want that for any of my patients. So I feel like when you come in, I want you to feel like you are my family, and I want you to feel as comfortable as you possibly can be.
Yeah. Well, this summer, next month, we're going into our 17th year at Cary Family Dental. So I started it from scratch 17 years ago with really the vision of being able to take excellent care of our patients and excellent care of our team. And I think the most important part of that is bringing in the right people to take care of the practice and take care of those that we're really trying to take care of in our community, and make sure that they have excellent experiences when they come into our office. And I think that by having you come into our office, you've really added you've been a wonderful addition to our office, and we're really excited to have you. So thank you.
Thank you. I appreciate it as well, although I don't say mom and dad at work anymore, but I still feel like I have that family feel with the Cary Family Dental practice here.
Oh, well, thank you. All right. Well, good. Well, if you get a chance to meet her, she's awesome. And if you've got any questions, reach out to me, reach out to our practice, and we'll see you soon. Take care.